This is the Unshadowed Thought Podcast with James Hall. This podcast is dedicated to Michelle Goyevich, Ed White, Caitlin Treacle, and I Chan, and also all the others that have lost their life as a direct result of psychiatric harms.
All right. Hey, Trudy. Thanks for coming on the podcast tonight. I'm really looking forward to it. And thank you for all the help and advice and ideas that you've given me since we met a while back. I know people are really interested in hearing about involuntary commitment and ECT and kind of this um, philosophical like conundrum we get into with psychiatry. And I know you have a lot of experience with that, way more than me, but I think we see some of the same things. So I'm really excited to talk to you about it. And first off, let's try to give people some context for the people that don't know you. We were just talking a moment ago about how getting involved in psychiatry is typically really a kind of a benign thing, but ends up having really serious consequences. What set the stage for what it was like when you first kind of ran into psychiatry and what was going on?
Yeah, sure. So thanks for having me on tonight. So yeah, I used the word benign when we were just talking because it was kind of a run-of-the-mill story of, trauma and PTSD and depression and getting referred to a psychiatrist and being told here, here's an antidepressant, take these pills, no problem, you'll feel better. And, within 6 weeks, things were worse and I was actually in hospital for the first time. So it was like I started down this trail of thinking, okay, I'm doing this for myself. I'll follow what the doctors say. Everything will be okay. And then I'll just go on and live my life. And as it turned out, it was like the tipping point that made everything get exponentially worse.
Yeah, that's a quick escalation. Um, how did it escalate so quick? You said it was like 6 weeks, right, from when you started to when you were in the hospital. What was
Yeah.
what escalated it?
So I think part of it was that I really quickly gave my power away. So instead of fighting and trying to do the best that I could to kind of cope day to day, I thought, okay, here's all the answers. All I have to do is listen to this person who's in a position of authority and they're going to fix me. I was
Yeah.
young, right? I was 18 years old, 19 years old, right in there.
Wow.
And so I was still a kid. In hindsight, I was not mature. I didn't have life experience on my side, and I was looking to be taken care of. And I mistakenly thought the psych system could take care of me and make me feel better.
Yeah, it sounds like you were trusting. I think at that age I was too. And like you said, you lack experience, so when people in authority positions offer you a solution to a significant problem, like you're gonna take it at that age. I see that's a really big problem with psychiatry in children. Like it's a really high stakes game, and yet they seem really quick to like medicate people that kids or that are still in development. And to me, I mean, you hear all this stuff about ADHD and medications and kind of these rampant, delivery of diagnoses, and I just don't see much consideration for the consequence. Like if a kid's, acting up or acting badly or is not controllable or isn't conducive to like a learning environment at school, like generally, like how I understand it now is like they just start walking them slowly towards medication, if not quickly, and then that's just so disturbing to me.
Yeah,
But
I definitely see that. And it's interesting, thinking about how little has changed because this was the
yeah, how long
90s
ago?
when, I was first in the system. And you would think if you've recently started an SSRI with somebody and they're magically suicidal within 6 weeks, you might go, hey, like maybe the medication caused this and pull the medication rather than hospitalizing them and adding in, benzos and antipsychotics and a mood stabilizer and like this whole polypharmacy situation, like boom, just like that.
Yeah, yeah, it's just That's so wild to me. So did they start you out on like one SSRI and then it escalated and then you were hospitalized? So let me know how the drug progression went. And then also, was that first hospitalization, was it voluntary or involuntary?
So first one was voluntary. I was on, I don't know, what probably would have been Prozac or Zoloft. I don't remember which anymore, but it was one of the first SSRIs that they start you off with. And yeah, as soon as I was hospitalized, they had me on clonazepam. I want to say chlorpromazine. I'm not sure if I've got the right one, but it was one of the first line of antipsychotics. They had me on sleeping pills, and I think that was the hospitalization. They started me on lithium.
Okay. Interesting. So obviously a lot of tranquilization, like they're just trying to get you to like non-function or to blunt you, I guess is what I always kind of think of.
Yeah, I mean, it was incredibly numbing. And I don't have super clear memories of like, did they start all the meds right away? Was it little bit by little bit? I know I was in hospital for 6 weeks and I came out of hospital on a lot of medication. And I was realistically on that much medication for a number of years, until actually my last hospitalization was the point after I got out of hospital last time where I was like, okay, these meds are not helping me and I'm going to start getting rid of them. And so it was a lot of years where I had a lot of meds I was taking, and the pharmacy, bubble packed them and whatnot. But there was a period of time where you could list a med and chances were I'd been on it.
Wow. Yeah. So that's an interesting progression at the beginning there, which when I think of my situation, I feel lucky considering it against yours because I had like a breakdown at work and I was from stress. And then I really was hesitant about taking any psychiatric drugs. Like I knew it probably was a bad idea, but I was in such a bad state. I went to my doctor and was just looking for something to maybe relax me so I could get my footing again and go. But they gave me Lexapro, which gave me akathisia, which I had no idea what it was at the time. All I know is that my mind was absolutely off the deep end. And so I went to him to get it fixed. But what I was feeling was just so wild. I don't know how I kept my head, but I could have easily ended up in the ER and been polypharmacied after that. I could have easily been committed, or any number of things could have happened if I just would have had a little bit less self-control, maybe, or maybe was in a little bit less belief that it would help me. Like when I was kind of skeptical, I did the Lexapro, and then I reacted badly. So I knew I had to just stop it. Like I was trying to give the doc a chance to help out, but I was like, I'll just stop it in the meantime. But he kept urging me. He's like, just take more. If you increase it and you stay on it, everything will go away. And that would have that would have landed me in massive trouble, and that would have been my
Yeah.
first interaction, which yeah, I could see it. It could have gone a completely different way, but instead I just backed off of everything and then tried to minimalistic approach the rest of the time I was involved with psychiatry. So that's really interesting. So how did it progress from there? So you had the first hospitalization, they polydrugged you, and then I assume they just kind of sent you home with that regimen or a similar regimen, right? To just kind of keep you from being a liability or keep you from like getting into
Yeah, pretty
trouble.
much. They send you home and supposedly everything is going to be wonderful. And I think I was back in hospital in 2 weeks, after getting sent home. And so for a period of a number of years, I was in and out of hospital a lot. And I actually found out I was pregnant with my oldest because I got more depressed when I was pregnant with her. And my doctor just happened to run a pregnancy test. And I got a phone call later that day saying, you have to come to the hospital right now because you're pregnant and we have to change your medication.
Oh my gosh.
Yeah, and like totally shocking. I was married, so like getting pregnant wasn't an impossibility, but it certainly wasn't expected at the time. And finding out like you're pregnant, come get admitted, like all in the same sentence, like that was a shock.
Did you even could you even process that? Because you're right. I did, even when you were saying, I was like, oh, you're pregnant. That's huge. I wasn't even thinking of being like come down and get admitted. Like that's a whole nother consideration we should make. We don't always. We just might roll with it. But how did you process it? Were you just like on autopilot at that point, or do you even remember?
I was shocked.
Yeah.
And I think really scared because I was on Tegretol at the time that I got pregnant, which is known to cause spina bifida.
Wow.
Uh, and so it was a lot of like, we need to do this extra testing. We have to get you off of this medication. We don't know how your baby might be, if your baby will be okay. And so there was a lot of fear and I think guilt as well. Because as soon as you find out you're pregnant, you feel responsible for that life growing in you, right?
Absolutely.
So to know that I was pregnant and was taking something that I'd been told, like, this is what you need to do, and that it might have hurt my baby, like that's really big stuff.
Was there a point, I figure we'll get to it, but was it at this point or was there another point where you started to kind of question like the whole psychiatry bit where you're like, maybe this is a bad idea, or I feel disempowered or I feel out of control of my own situation? Did it start there another time or?
It was actually after that. I was still pretty at that point. I didn't really feel like anything beneficial was happening, but I also wasn't looking for alternative solutions yet. Like I just kind of thought, this is the way it is. And, again, I was 21, so I was still young. And there's something to really be said about age and getting to know yourself and just developing the ability to be like, yeah, this is what's right for me, or this isn't right for me. And just learning that it's okay to say no. That was not in my vocabulary at that age. So just the idea of being like, no, like that, I think the first time I ever told my doctor no was when I was on Zyprexa and I had gained like 60 pounds in 6 weeks and I just blown up literally. And I finally said to her, and I kept saying, like, I'm just gaining weight. I can't stay on this. And it took me 6 weeks to convince her to stop it. And even, looking back in hindsight, I didn't say to her, like, I've stopped this. I'm not taking it anymore. I was still looking for her permission to stop taking it. And it's, it really illustrates how when you buy in, you're not like, there's this
Yeah.
whole, here's what I'm recommending, here's the possible risks, here's how I think it might help you
People
kind of discussion.
people think it's like a free, like everyone's free to just stop and like make their own decisions and like the patient's really responsible. But in most cases, I don't think that's true. I think you feel like it's an authority figure, and I think psychologically, like you act accordingly.
Yes. Yeah, absolutely. Like, how how does someone say no to the person who's been put in the position of this is the person who's going to make you feel better?
Yeah.
How do you say no to that?
Yeah. Morally, ethically, like it's kind of a non-starter. Like you're not going to say no. And as long as you trust that person that they're not like trying to hurt you, right? They're trying to help you. You're just like you're going to say yes. You're going to be like they'll
Yeah.
get to it. They'll figure it out,
Yeah, and that, my first psychiatrist was fresh out of med school. She
Wow.
was super warm and super caring. So I
Oh,
I idolized her, honestly. I trusted her completely. And I believed even when things weren't going in a way that was helpful for me, I believed that she was doing the best that she could. And I think even looking back, I still believe that she was doing the best that she could. I don't
yeah.
think that she was at fault per se. It's the whole system structure, right? Like if you want to help people and you feel passionate about helping people who are in, dealing with different types of distress, then psychiatry is, it's the profession you would choose,
It's appealing.
right?
Yeah.
And so you take someone who deeply cares and then you put them into training them that this is what you do. This is
Yeah.
how you do it. I think I don't think it's easy for the doctors either to necessarily pull back and go, hey, am I helping or am I harming? And, it's something I appreciate about the doctor I have right now that, he point blank has said to me that, he's had a patient where he realized like the meds were harming her. And so he supported her in getting off of medication because he realized that was a harmful thing. And he's been amazingly supportive of me. Like I've been so blessed to have a professional. Like when I got off of all of the meds, the meds I was on, I went into that appointment not knowing if I'd come out of the appointment with still having a doctor or not. Like
Yeah.
I went in prepared to walk away, right? Like if I said
Oh, yeah.
this is what I want to do and he'd said nope, sorry, I can't help you with that, then I was prepared to walk away because by that point I'd found my voice. I knew what I needed. But 21-year-old me didn't have that insight.
Yeah. I find it really easy to get mad at doctors and to blame them, but the longer I'm around, like there's a lot less blame. They're really really integral, like in this grand trick of of psychiatry and the pseudoscience. And there's a lot of information pushed to them. There's a lot of indoctrination focused on them believing that psychiatric drugs are just not as harmful as they are and can genuinely help people in a big way. And a lot of stuff that I think the doctor sees from their perspective, unfortunately, like TMS, like when I was hurt, like I may have even looked better because my cognitive function dropped, so my anxiety dropped and my rumination that caused depression dropped. Right? I think doctors get a lot of this like confirmation bias, like they're pacifying their patients and they may have looked extremely anxious, so they're like, oh, it works. And you get a few patients like that, I'm sure it's tempting to think like, okay, the stuff works the way they're presenting it.
Yes.
They're not looking at long-term outcomes, right? Or if someone's developing a neurological condition or disease later, 10, 15 years later, they're probably going to tend to not blame the meds or, an ECT or TMS. Like I understand that, I get that. It's a really tricky situation. And again, it's easy to blame doctors, but I'm not sure that that's the most appropriate thing. I think there's people that deserve a lot more blame than them. And like you said, I've run into a lot of doctors. Most doctors are really, really trying to help. It's funny, I had a conversation with someone on the Mad in America site too about empathy and kindness as a liability. Like the doctors that were most kind, I think, tend to be the ones that may be most harmful because they're really apt to try treatments. And if you're expressing a lot of pain, they're really apt to make radical things and not be critical of the situation and not think objectively. I've seen that thematically, like with quite a few people, and I think that was a part of what happened to me as well. Like I really played on the empathy piece, and doctors really wanted to help me out, and that's a part of what happened.
That makes total sense.
Yeah. So I'm curious. So what happened next, kind of in that timeline? You found out you were pregnant, and then
Yeah, I found out I was pregnant. They switched my medications up, and I had a healthy baby girl.
that's so cool.
And she spent a small amount of time in the hospital. She didn't have a suck reflex when she was first born, and that was from the medication. She actually went through withdrawal after she was born, where
Oh my
the
God.
staff at one point said to me, because at first I was told I couldn't nurse her because of the medication I was on. Then they changed their mind and they said you have to nurse her because she's in withdrawal and she needs to have some medication still,
Wow. That's
which is
wild.
interesting insight when you think like this was 1997. So it's interesting that they recognized that she was in withdrawal from prescribed psychiatric medication.
The implications that are so huge because so many people don't even acknowledge withdrawal right now, and it's been such a long progression. And then you're telling me that back then, not only not only were they aware of it like before she came, and they're like, no, don't nurse her. Then they're like, they identified it in an infant. I can't even imagine how difficult that would be, or not difficult. I don't know. It'd just be wild. And then they're like, then they did want you to nurse her. Like that is so telling. Side anecdote, but a lot of the stuff I found about TMS and the harm of doing it and different stuff, like all the research that I'm reading on showing the physiological effects like of both chemicals and electricity on the body, stuff is coming from like the 20s and like the 30s, the 50s, and maybe the 60s. But they knew about these harms like almost 100 years ago, and like physiologically how they affected human cells and stuff. So I mean, we say the 90s, and based on how we see things going now, like it's kind of a revelation. But I know that science knew about this like way, way before that, and we're very well informed about it. So it's kind of a sliding scale, but that's pretty interesting.
Yeah, it's this is actually the first time I've really thought of it this way. Like in the whole withdrawal context, it's fascinating actually to think back and be like, huh, like how did they figure that out? Like,
Yeah,
what are the chances, right?
yeah. Even you
But yeah,
yourself probably know more now, and we're looking back at that with a question mark. Whereas at the time, where you probably were just took it for granted.
yeah, I had no, like I believed them when they said I couldn't nurse. I just trusted when they said, oh, now you have to nurse. Um, yeah, so that was kind of she came home and I ended up getting some postpartum depression. And that was what led to me ending up back in hospital when my daughter was 4 months old and getting my first set of ECT. So they were looking for something that was a little less invasive, which is a true, like, I'm laughing because it's the most bizarre thing. Like, here's this safer, quote unquote, option since you have a baby that you're nursing.
Oh, that was the
Um,
perspective. I see.
yeah. Um, and like, what a bizarre thing to offer, to a mom with a newborn.
Oh yeah, absolutely. I don't know. It'll probably take me a few days to wrap my mind around that one. Um, but certainly when you mention that way, I see the perspective. They're like trying to avoid any contact with the child through like a chemical intervention, like sure, but it's so invasive. I mean, I feel like science has always known that ECT was invasive. It's hard like to let people skate on that one. But again, from a doctor's perspective, I've seen the literature, I've seen what manufacturers put out trying to make it look non-invasive. They've constantly tweaked the manner of application to make it appear as if like it's a new cutting edge thing, or there's this new change to treatment, like the voltage and the application and this stuff, to make it look like it's less invasive. But those of us that have looked at like the physics of electrical electrophysics or whatever you want to call it, like just the physical science, right? It's always the same thing, right? Like there's current and amperage, and it has this effect on human cells and stuff. So it, again, wild to me, but you can see the perspective. But how did you feel about it at the time when it was first mentioned to you? How did you feel like immediately about it?
I don't think I actually knew much about it when they first said, this is what you should do. And I remember them, putting this video on the TV that was like, here's what to expect, here's what the risks are. They gave me a leaflet to sign your life away and say that you understand that you might suffer, permanent memory loss, but don't worry, it's rare. You might die, but don't worry, it's rare, like all of these things. And, I was certainly not in a position to be like a mental state to be consenting to that, because I was suicidal at the time. Like,
Yeah.
how bizarre is it to hand someone a piece of paper to sign to give consent that includes on it, you might die from this procedure, when
Aside
you're
from
like,
death.
okay.
Yeah. Yeah. It there's this whole conflict of interest that's, involved, I think, through the whole process of psychiatry, and that's massive, like it's almost, I mean, ethically, even informing someone, I mean, you have to obviously give the best informed consent as you can, but if someone's suicidal and you inform them that the side effect is death, like it creates a conflict.
Yeah, like, is it a meaningful consent? Can you actually consent to something that carries the risk of death in that mental state? I don't think you can. I don't think that, because for me, mental slowing was a major part of my symptom set when I was in the worst place. And so, even cognitively understanding the risks, like, does long-term permanent memory loss, do you understand that? Like, I was 21. At 21, can anyone imagine permanently losing part of their memory and living the rest of their life with that piece missing? Like,
No way.
no
Yeah.
way. Like, even someone who's not depressed, who's in their, happy, healthy state of mind, there's no context that a 21-year-old has to imagine what it's like to lose a big chunk of memory and never get it back.
Yeah, I completely agree. Um, there's the experience factor that you mentioned before, and then absolutely, I think every single time I made a decision about either doing TMS or taking a psychiatric drug, like I wasn't fully cognitively available, like just period. My brain function wasn't that high. And then second, I was emotionally completely compromised, where I mean, you could ask me to do all kinds of dumb stuff, and I probably would have done it, right? Wow. And then just thinking about it with ECT, it's just a whole nother level. And especially in your circumstance, I think about that and having a newborn at home at the same time, and the situation you were in. It's just like there's no way that's like it has any kind of semblance of rational like responsibility. Like there's just no way.
Yeah, it's crazy, to think back at that time and to think about, what my recollection is. And it's interesting because I have some, like, that first set of ECT that I had was the one that caused the worst memory loss, but it didn't take away my memory of, like, being on the stretcher and rolled into the room where they did ECT. I wasn't rolled in. I climbed up on the table. Like, I remember climbing up onto the table, and I remember what the recovery room was like, and I remember the smell of the anesthetic, and I remember, looking up and talking to my doctor in the room right before I went under. And, like, so I have very vivid memories of the ECT room itself, which is bizarre when you consider that, you know, I lost somewhere between a year and a half and 2 years of memories, like,
Wow.
just vanished. I didn't remember how to navigate the streets in my city, didn't remember movies that I'd seen. Like, my husband and I, every once in a while, we still find a movie that was watched in the time period where my memory was lost.
Yeah.
And he'll say, "Oh, yeah, remember this movie?" And I'm like, "I haven't seen that movie." And he'll be like, "Yeah, you did. We watched it together." And I'm like, "No, I've never seen that movie." And, in the early days, we would have like arguments over it where he'd be like, "Yes, we did." And I'd be like, "No, I didn't." And then we figured out, because the funny thing about memory loss is you don't even have an awareness that you've lost it. So,
Yeah.
like, to me, my truth was this event never took place, because it's like just erasing a whiteboard. Like, it's just gone. It's like it never happened. So, to me, my truth was this thing doesn't exist. It never happened. And yet, there's, photos that I can look at and I'm like, "Oh, look, I'm in this photo." I
You're like,
clearly was there.
yeah.
Um, but it's it, it and it's hard to you feel like you've lost part of yourself. Like how do you get back in touch with yourself after that and even develop a sense of identity of who you are
Oh yeah.
when you have these chunks of yourself missing that can't even be defined? Like I don't know that that piece gets talked about enough,
Yeah.
where, you have to have a strong sense of identity to heal and recover and be healthy and happy. But how do you form an identity when parts of yourself are just gone?
Yeah. I was gonna, as you were talking, I was thinking about the same thing. I was like, because we were just talking about kind of consent and what that means, understanding what you're getting into. And then as you were going on about the memory loss, I'm thinking the one thing that I try to communicate to people that are thinking about doing TMS, and what I think about often myself, is it's it's not impossible, but it takes a really, really imaginative person to understand um, the logistics and to think critically about what's it like to have a damaged nervous system, like, because all your function changes. Like just saying someone I have memory loss, right? They don't think functionally, like what does it really look like to have lost a piece of your history? Like you said, like people are going to be like you were here or there, like, and you're going to be like no I wasn't, because you didn't cease to exist, right? So you think you know everything that you know, but you don't know what you don't know. So there's these memories gone, and it creates conflict. It creates irritability. Your brain has difficulty functioning around that. And then to what I was saying as well is like, I know we talked about vestibular issues like right now, like you have this propensity to get off balance more. Like a lot of people's vision changes. I have tinnitus. A lot of people get tinnitus. I have this ringing in your ear. And then like I'm processing light differently. Light's coming in, it's irritable. Even my digestion like stresses my brain. Um, Getting someone to think about that up front or to know what memory loss really means is like a virtual impossibility. Again, it would take someone like incredibly smart and creative to follow the logic of like, okay, if I had memory loss, this is all the things it would affect in my life, and this is how different I would be. And if you're young, be like, what is it going to be like to be 60 years old and be missing, years of your life and have to live through that? Um, and I don't think people think about that a lot, but it's critically important. Like again, when people are looking at doing TMS or ECT or anything else, think about what it's going to be like to exist inside your body like after that happens. Like it's incredibly heavy, and no matter how much someone tries to describe it to you, they'll always fall short. But
Yes.
living through it, like that's
Yeah, and I think sometimes, like some of the challenges that I'm dealing with right now, and I think, like, will these challenges say stay static, or are they going to worsen as I get older? I mean, I don't know, and I probably purposefully wouldn't research it because I wouldn't want to scare myself, but did they ever test ECT on 20 or 21-year-olds and look to see like what's the long-term effect? What are these individuals' lives like by the time they're 60 years old? Like, there's some research out there on antipsychotics and various medications and how it's known that long-term use can shorten overall lifespan. But what am I facing from, realistically, what's baked in already to my brain and my body as I age from, having had over 30 ECT treatments? Like that's a
yeah.
big question, and nobody has the answer to that because officially, the effects of ECT are short-term and self-limiting, right?
Yeah. And this is something we were talking about also the other day. It's because that's so critically important for people to understand. And I think like depending on where your demographic is, there's a lot of seniors in my area I live in, so there's a lot of retirees. So it feels to me that doctors are a lot more flippant about their treatment because a lot of the patients they treat are at the end stages of life. So they don't give consideration to what the side effects are, what's going to go on. They just don't. And to me, it's super disturbing. I talked to a few doctors that were trying to learn about TMS and the harms. They actually reached out, and I was like, fantastic. And I found out that the largest percentage of their patients is geriatric community. And I'm like, you're not going to realize much about destroying a senior's cognition because you expect them to be cognitively deficient, and then like this is a massive ethical problem, and then you don't even live to see, a lot of them don't live to see the consequence. So, what that's problematic. But then, like the original point I was making with you is that they stop studying drugs and treatments after it's approved. And there's the biggest body of evidence, the biggest learning opportunity comes from when this stuff hits the open market. And now you have a massive demographic of people that are having reactions and experiences with these drugs that we could learn from. And yet that's precisely when we stop learning and we stop recording data and taking in information. I mean, some of these drugs that have been around forever, we could know so much about them. We could be super precise with mapping like the effect and the consequence over 20, 30, 40, 50 years, but we're not interested in that. And we spend, I mean, as a society, we spend our money on other things, but I mean, you have to argue like what's more important than that at this stage in history, And it's a missed opportunity, even if we started now, right? Like,
Yeah. And it's interesting because there's even a word for the failure to study, if you think about it. Like, have you heard of idiosyncratic reactions?
no.
So idiosyncratic reaction just means you had a reaction to this medication that isn't documented in the prescribing information. So it's like this single-use term that you can apply to
Like your
anybody who
atypical.
reports a side effect that hasn't been listed by the manufacturer. And the only reason I know it was because, and I self-describe it as saying, my body likes to react to medication in unexpected ways, but I learned the word when I had one and was told, oh, this is an idiosyncratic reaction. And like it was it's weird when you're on the receiving end of that as well, because, I think it was probably the first time I heard it, I'd been forcefully sedated and they injected me with, I couldn't even tell you what they injected me with, and it basically knocked me out for 2 days. And by the time we were into the second day, I was being accused of faking it. And because, this medication usually barely touches people and you should have been fine within 3 or 4 hours. And like, there's no way it's possibly active in your body still 2 days later. That's what I was told. Right. But I wasn't faking it. Like, it truly did knock me out for that long. And it's wild to think that, here's these people in a hospital that are just willy-nilly, like, and when they did that, it wasn't because I was in distress or anything like that. They did it to teach me a lesson because I had been upset. I had locked myself in the bathroom and didn't want to come out because they were being rude. And so when I decided to unlock, and like, in a hospital, they take away everything, right? There's nothing you could possibly hurt yourself with in a hospital bathroom. So they were just mad because I didn't come out of the bathroom when they told me to. And that was the reason why. There was a different doctor on call. My doctor was away on vacation. So the doctor didn't know me or my history or anything like that. And instead of offering empathy to, a patient who's decided the bathroom is the safest place to be in that moment and doesn't feel safe to leave the bathroom, when they do leave the bathroom, they, hold you down and inject you with a medication that knocks you out for 2 days. Like, it's crazy to think about. And then, to take it a step further, you then accuse the patient of lying about being knocked out. Like, you're just choosing to be lazy and stay in bed. You don't need to be in bed. Like, it's wild.
Yeah. That brings up another point. The last podcast I did with Sam, she told me there's a few examples of drugs she had been reading about where a 1 milligram dose, which is a fraction of the minimum dose, is like talking about like 20 milligram dose drugs here, like with a minimum dosage, right? Like 1 milligram of some of these things were occupying like 30 to 40% of receptors that they were trying to act on.
Oh.
Yeah, and what you said, I'm laughing over here because I've had the same reactions that you have, and I've almost every time I had seen a psychiatrist, um, I had like an overreaction to a minimum dose, and it seemed to be always be a pattern. And when Sam brought that up, it was like the light went on for me. And then I had read other literature saying that there's a reason pharmaceutical companies pick this minimum dose, which is often a lot higher than what they know could be effective, and they calculate it based on these things. And then there's these other situations where if they use less of these active drugs, they're no longer considered like prescription drug, right? So they can't sell them in that way.
Oh.
Yeah, and I've been on minimum doses before, and I'm like, I'm reacting too seriously. Like if I could just be on a fraction of the minimum dose, I think this might actually work or be helpful. And then it obviously there's no way to do it, so we just kind of threw that out, and like they would change drugs or try to polydrug. Um, but I mean, it's a highly interesting thing, and that reaction that you had. I mean, it sounded like exactly. I'm trying to remember specifics, but it sounded exactly the way I've reacted several times. Like, and there's another thing like with the half life of drugs. I've been told like, hey, I still feel this stuff in my system, and they're like, well, the half life was like 2 days, and you're like, it's like a week later, and I'm like, well, cognitively, I'm still slow from whether it was a benzo or whatever, And they're sitting there telling me the science behind it, and I'm like I'm like, how diverse is the human body, and how diverse is my diet, right? And all these different chemical things I have in my body,
Yeah.
and how different is every other person I've ever met or seen come into this office. And you're trying to tell me that what I'm experiencing is not possible, right? And I'm just like, this is kind of
Yeah.
ridiculous. It doesn't make sense.
Oh my goodness. Yeah, because you think about it and it's like the first thought to my head is, oh, so you're telling me I'm at the middle of the bell curve? Like, how do you know?
Yeah,
Please explain.
yeah. And then, of course, if they were tracking the data or something, or they were tracking patients, say if every hospital, actually kept track of the reactions and stuff, they would actually be able to put you on the curve and be like, oh, this is actually idiosyncratic. Or they'd be like, no, actually, we cross-referenced it and we've seen 5, 10, 20 of these reactions. Uh,
Yeah.
it seems like everything would make a lot more sense, at least. Even if things did seem harmful or wild or whatever, there would be some reference for it that would actually be grounded in fact.
Right. Yeah, it's wild to think about, and I guess the cynic in me can't help but question if they don't collect the data because they just don't want to know, like plausible deniability, right?
Definitely with pharma. I mean, with the studies they run, right, they're looking for a fixed kind of outcome, and they have every reason in the world to disregard any other complaint, and or they're not obligated to report, anything. And not to mention the fact we've seen it tons of times, there's walkout rates and all kinds of stuff that's reported. I mean, even some of the TMS studies you've seen weird stuff, and then you're wondering like what really happened, like because you're getting a fraction of the story, however they wanted to interpret it, which of course is psychiatry. All the reports, right, are subjective anyways. They're talking about remissions in depression or anxiety or whatever. You're like, what does that even mean? Like I've experienced like 20 different forms of anxiety or depression in my life that like have all kind of been different, but
Yeah, it's interesting because so I was recently reading, I don't remember the name of it now, but there's a new medication coming out that uh, I don't remember what Dex. Yeah, I'm not going to remember exactly the ingredients, but a portion of it is bupropion, like the active ingredient in Wellbutrin.
yeah.
And then the other portion of it is an active ingredient in cough syrup.
Sounds
And
familiar. I swear someone was on Wellbutrin and they just told me their doctor. They just went in and the doctor's like, "Hey, let's switch to this one. It's got another active ingredient in it, essentially." And they're like, "Why am I just going to change it randomly? You think this is just going to magically help me more because we're adding like a drug and because I'm already taking it?" But I'm sorry, continue.
yeah, so I was reading a little bit about it because someone mentioned in this discussion that it increases glutamate levels. And so alarm bells went off in my head because glutamate is like this Goldilocks hormone in your brain, right? Like
Yeah.
it's, you get too much glutamate and it's cytotoxic uh, to your cells, and it's very highly regulated in your brain. It's what allows your brain to communicate with itself, basically. And there are some autoimmune conditions. I want to say it's autoimmune, but there's a condition where if you get too much glutamate, it can actually start to cause cognitive issues. And so one of the medications I was on was actually tested to see, because it's known to reduce glutamate as a secondary effect. And so it was tested to see if it could prevent progression of this other illness because it's reducing glutamate, and it failed the trial. I guess lucky for all of the people with this condition that they never have to deal with that medication. Uh, but as I'm reading this, new hopeful,
Oh
and
yeah.
I'm using air quotes, because I
You-
don't believe it's hopeful at all. I
You'd be
believe
so
it's
excited about it, Trudy, you know.
dangerous.
You would be.
Um, yeah, I'm dripping sarcasm, right? But all I can think of is, oh my goodness, people are going to increase glutamate in their brains. And if they are feeling better, the only way you're possibly feeling better from that is you have legitimately killed your brain cells. Like, how is that a good thing?
Yeah. Yeah, absolutely. I kind of keep coming back to this idea that, people think they're learning about all these receptors and the neurotransmitters in their brain, and they feel like if they mess with them, there's like this is some sort of good thing, right? Like if I can just get more dopamine or serotonin, I'll feel better. And there couldn't be anything further from the truth. Like if you were balanced and your brain was operating as it was intended, then you might feel better, right? But getting more or throwing it off or adding it or changing it, shifting it is likely one, probably not going to make you feel the way you think, but two, create an imbalance in another direction that's going to, cause some sort of potentially catastrophic issue or something that's going to take years for your brain to rectify with neuroplasticity or whatever.
Yeah. I always think about, I guess I've reached the point where I'm like, the body loves homeostasis, right?
Yeah.
Like that's the body always wants to be stable. So you either need to get out of your body's way, whether that means, getting the exercise you need, getting the sleep you need, drinking enough water, eating healthy foods that support your body. And then your body can find that homeostasis that it so badly wants. Or you can throw extra things in that just makes your body have to work harder and disrupts homeostasis. And that's really how I view psych meds now, is it disrupts homeostasis, and maybe temporarily it changes symptoms, but is it actually causing a physiological improvement, or is it that you've disrupted homeostasis and so your body is so focused on trying to fix what's been upset that you're just not aware of the things you were aware of before.
Yeah.
And I think that numbing effect, that's the word that I use for it, is just numbing. You used a different word for it earlier on.
I like to use
Something,
blunting, like
yeah,
using that one.
yeah. But I think that's, taking the edges off. I'm not sure that that's actually a good thing for a person. I think it's more just a sign of your body is really fighting for homeostasis right now, and
Yeah.
it's all hands on deck for that. And so you don't have the capacity to worry and think about other things right now.
I couldn't agree with you more. That's so well said. And I've thought back, like to my experience of when I kind of came off the rails, and I thought about that as like I looked at the way I was feeling as a problem when I should have been looking at the way I was feeling as a signal, right? That my body was
Yes.
pushed so far out of homeostasis that it was trying to come back to balance, and I treated it like a disease instead of a signal, or a sensation. And then after TMS, I learned further, like I did so many things to try to force myself back into feeling well, um, it always ended badly. And instead, I came back to these things to try to help my body balance itself, like eating while exercising, getting sleep, like regular sleep patterns, all this stuff that put me in kind of a state of normalization. And then my body always responded well to it. Like, did I have drastic improvements immediately? Like, no, I didn't. But things slowly kind of started to rectify. And I think a lot of people want a quick fix, and it's just not happening, you know?
Yeah, that's exactly what came into, my mind when you were just talking, was the whole, that's what a pill promises, right? Take this pill. All you have to do is take it every single day, and magically everything is going to get better. But, you know, any problem is complex, whatever the cause may be, whatever the situation is. And problems don't come up unless there's a whole bunch of things, because, we're pretty resilient as humans, right? So
Absolutely.
to imagine that we can solve a complex problem with a simple swallowing of a pill is perhaps in hindsight a little bit naive. It's maybe hopeful and maybe, full of wishful thinking. But when you think about the complexity of a human being in general, it's not so realistic.
Yeah, I think we talked about this a little bit another time, but I always had this like serious apprehension towards that like simplistic answer, like take a pill. Like I was like, this is too easy. And ironically, I didn't have that with TMS, and my wife was like, no, it's too good to be true. Like you can't, like it's not, it doesn't work like that, you know? And she couldn't articulate it well, which put me in the situation of being like, oh, well, I know better than her. I'll just go do it and I'll talk her into it, right? And she had empathy for me, so she allowed me to do it or didn't stop pushing back, and then got myself into trouble. But you're exactly right to think that the answer is that simplistic in such a complicated system that is our body. I mean, we really don't give ourselves enough credit and our bodies enough credit, right? Like the more I learn about it, like I learn how complex and like wonderful it is that it can do all these functions. Like you're processing trillions of sensations in your brain like every nanosecond. And the only thing we can have some simplistic intervention is just like it gets really ludicrous. And you talk to some scientists, and I actually had a good doctor a while ago. He's like, we know less than 1% about the brain. And this was like a top doctor in my state. And he's like, and I don't know anything about the brain. He's like, I've done all this school and all this stuff, and I still don't know anything. He's like, we can try stuff and try to help you, but we don't know what we're doing essentially. And that honesty was like really powerful to me. That's why I chose him to stick with him, because I'd been through a bunch of neurologists. But like at least he could admit that, right?
Right. Yeah. We don't, I mean, there's so little that is actually known that I think it's would be true to say that we don't know what we don't know.
Yeah. So getting back to the ECT and stuff, um, so that was interesting. So not long later, you ended up for ECT to avoid, the chemical intervention that I'm sure they would have thought about otherwise. And then, and then the other thing I wanted to point out is that I've talked to quite a few ECT survivors, and they seem to have that same vivid memory of the hospital. I'm wondering if almost it's like the survival mechanism, like your brain knows something like really, really significant is happening, and like it's just imprinting and giving you a strong connection to those memories. Like almost all of them can recount like in great detail what it's like to get wheeled back, what the smells were in the room, like what it felt like to be on the bed and to get administered the anesthesia and all that stuff. And so it's really wild to hear you kind of recount that as well.
Wow. That's surprising to me because I haven't had a lot of conversations with other ECT survivors. Like I'm in a few groups, but I honestly don't go into them a lot because they're kind of scary sometimes. And I try to not let myself go down that path. So um,
Smart.
it's fascinating because it's always kind of been this question mark in my head, like how can you lose those things but not that piece? Like it's so, but maybe it's like you said, that it's such a powerful state, or I don't know, maybe the electricity freezes it into your memory or something ridiculous like that. I don't know, like that sounds maybe harsh to say, but it's, one of the memories I remember having is seeing some of the, because they don't do all things before you're under anesthetic. But when you're in the room, you see the pieces that they do use, like the bite guards and that sort of thing, right? So I
Yeah.
don't have any memories of having a bite guard put in my mouth or being intubated or any of that because I was under anesthetic when that was done. But I have memory of seeing the things that were used and feeling kind of, I'm not quite sure the right word. It's like a type of fear, but it's not raw fear. It's almost like, think Middle Ages torture devices. Like if you saw something and you looked at it and like a, maybe like a stretch table, and you knew
Like,
that you were
what's
going to get,
that for?
yeah, right. And imagine that you'd been on it before. Or you understood what it did and you were about to get on it and then you see it. Like that was the kind of feeling, like here's this kind of
It's chilling.
thing that I know that they do when they're doing this thing that is really, I would never want to see done to myself. Because I think I had an understanding that it was traumatic to the body. That I think my feeling, and I honestly don't, I guess it's probably more a feeling than a fact. If I really think about it, my feeling was that ECT was violent.
Yeah.
The reason I say it's probably more feeling is because they give you chemicals to paralyze your muscles, so you're not physically having a seizure, you're not physically shaking all over, right?
Yeah.
Uh, but that was always my feeling of it, was that this was violent, which is, I hadn't actually really realized that until our conversation. I'd never really thought of it that way, but it's it definitely has that sense of like, here's this, I'm subjecting myself to something that's violent, but I feel like I don't have a choice about it.
Yeah, that's really interesting. And then the environment, like they administer it in, right? It's like kind of calm and sterile and all this stuff, and that like what's going to happen next, even if you can't remember it, is going to be anything but that, right? Like something kind of savage is going to take place. I know I told you about this earlier today. Like I had surgery in my transcript. I went through it, and this was a big eye opener for me. Is like I started crying when I was reading it because I realized that like they were flopping me on and off the table and like yanking my arms around and stuff, and it was written in the transcript, and they administered a lot of drugs and different stuff to me that I wasn't aware of, and like they had a tourniquet on me and all kinds of stuff, which maybe is standard operating procedure, but I didn't know. But when I came out of surgery, like I felt like I had literally been beaten with a bat, and like I told a few people that I was like, dude, surgery's brutal. Like I felt like I was physically beaten really hard when I got out of there. And we all kind of chalked it up to being under full anesthesia and having your body cut open and this different stuff. But after I read the transcript, I realized that I had actually like been beaten, essentially, not violently in a fit of aggression, but like my body went through the same trauma as someone would do if you just beat the tar out of them, flopped their body around on the concrete and tugged on them and punched them and whatever. Like it was the same thing, and I felt it, and that was that was an eye opener for me, and it was another point where I realized how I had given up my own autonomy by submitting to a surgery and going under full anesthesia.
Mm,
And it was kind of an eye-opening point where I started to look at things differently after that. Because it was supposed to be like a low invasive, like simple procedure essentially. And even though I had kind of a gnarly scar, it was like a 45-minute thing. It wasn't open heart surgery or anything. It was kind of simple. But my perspective changed when I realized everything went into that. And then later on, I talked to some psych survivors who had similar experiences, and then talking to other friends and stuff and actually dialoguing about the stuff, I realized that it's vastly different than what's communicated to you, it's just like,
yeah. Yeah, that sounds horrible. Like I said in when we were chatting earlier, like I'm truly sorry that you went through that.
Thank you. I appreciate that. Um, yeah, it's interesting. I kind of appreciate it, right? Like it's one of those hardships I went through. Because I also felt really, really horrible after the general anesthesia. Like I was dizzy and nauseous and non-functional for almost 2 weeks.
Oh
And
wow.
yeah, and my image of it was that you're fine. You go in, you feel groggy for a day, and then the next day you're fine, right? It wasn't the case. Well, I talked with more people about it, and guess what? A lot of people are that way after, at least from the people that I talked to, and they had significant like health issues after anesthesia. And then started reading about it. I read that going under anesthesia is almost the equivalent to having a stroke every time you do it. Like you're basically giving yourself a brain injury, you know?
Yeah. Well, and it's, I've been under anesthesia because you're under anesthesia every time you have ECT.
Yeah.
And I've had my appendix out, I've had my tonsils out, like I've been under anesthesia a few bonus times, I guess you could say, in addition to ECT. And so it's something I sometimes wonder, like how much of the damage is ECT damage versus how much is cumulative anesthetic
Yeah.
damage. And I'm dealing with like I have word finding troubles sometimes. I have expressive dysphagia. I have difficulty reading on a screen. Like I do much better with paper, but there's certain challenges that I have now that I didn't have when I was a teenager in school. And it's it's very complex, this many years down the road to even try and tease out like what was caused by what. And
Yeah.
one of the medications I was on for 2000 to 2017. So, no, 2019. So like 19 years. Uh, that's the medication I mentioned that reduces glutamate in the brain. So just that medication, prolonged use alone, also reduces cognitive functioning. And that medication induced basically early dementia symptoms that cleared up once I was fully off the medication. But you have to,
Wow.
again, wonder like someone who spent almost 20 years on a medication that starts to have that cumulative effect. Well, how much of, my doctor gave the diagnosis of acquired brain injury, and the conversation was basically like, it's probably from ECT, but there's the possibility that a little bit of it could be from medication, and it's impossible to separate it out,
Yeah.
right? And it makes my history very complex right now with some of the things I'm going through, where it's like you have to decide with any given professional, like what part of my history am I sharing? How do I accurately reflect the complexity of my history without sounding like I'm crazy?
Yeah. Or
Um,
overwhelming the situation. Like,
Right. Yeah. Like, so I've taken to describing, for ECT, I just say I've had repetitive head trauma,
yeah.
because that's something that they can understand. I leave out the medication history because I'm off of it for, over 3 years now. So it's not an active recent thing. And I figure whatever's going on at this point, it's either can identify it and do something about it, or we can't. But I'm not sure the root cause is super meaningful at this point
Yeah.
versus identifying which pieces can be improved and which pieces I just accept and I learn to adapt and live with.
Yeah, absolutely. That's so funny. You said that you just tell them you have like a repetitive brain injury because I've talked to a lot of people. A lot of people have adversity with doctors and trying to get help for their TMS injury, right? Same thing with ECT or people in withdrawal. And a lot of people are asking like, well, how do I handle the doctor because I don't have a diagnosis for a brain injury? I'm like, you don't need one. Like, you just go in there and tell them what you know. Like, this is what you know about TMS. Like, it was repetitive electrical brain injury. I like, you tell them whatever you want, whatever's going to get the job done and communicate what happened to you, tell them. So you don't need to say anything about TMS, because everyone's like, oh, I have TMS, and they expect their doctor to believe them when they say it's a head injury, and then they create this extra conflict, like with the doctor understanding and then starting to gaslight them. I'm like, just skip it. Like, just tell
Yeah.
them, you don't need their approval that TMS gave you a brain injury. Like, you just go in there and you tell them, like, I have a head injury, like, here are my symptoms, it affects this or that, this is what I'm trying to accomplish. And I think that part of advice that you gave is like so critical for anyone listening, or for you and me to remember going forward, is like, you just give them what they need to know. You know, People get really concerned with the details. It's like they're not important. And you don't need people's approval on it either.
Yeah, you're not doing yourself any favors by trying to make sure that they know every single detail. And I had great success with a recent assessment where I said, I've got a very complex medical history and I know that there's multiple pieces. And I think that this is one piece, and I'm just here to find out whether it is or whether it isn't. And the professional said, yeah, absolutely. We can figure out whether this is, we'll check off the box. And, I think I'm in a bit of a lucky spot in that I have things showing up on testing.
Yeah,
So they're able, the professional was able to say, okay, this is a small piece. It's not the whole piece. I'm seeing other things that are outside of what I treat, and basically said, keep following up with the neuro ophthalmologist because there is more stuff going on. So I look at that as a good news situation because, like, here's this piece that I can do something about, and I'm clearly with the right professional. And
yeah,
it's, even though it's not all good news, it's validating. And
yeah,
there's something validating to know that, okay, these challenges and struggles that I'm having are something going on in my brain. And it's, maybe it's something that happens for everybody with age, maybe not. I don't know. Like, I don't have enough answers to know what my story is right now, but I know that having things show up that are actionable in a non-invasive way gives me a lot of hope. Because the vestibular piece that we were talking about, it's, lay in this position, change positions, change positions. Like, it's not invasive at all. It's incredibly non-invasive and gentle with a potentially really measurable difference. Like, how fantastic. Why can't all medicine be like that?
yeah. I noticed earlier on that rehabilitation in physical medicine was definitely going to play a part and be the key to getting a realistic result. Because everything else, every time someone's like, "Oh, we have a medication that we can try with that," I'm like, like, I don't know if that intervention's going to be the most helpful or yield the best results. Like, you're going to pay as much as you get better, at least. And then, so, like you said, going to vestibular rehabilitation was the most effective thing I've done medically, like, since my injury, and it was really helpful. And yet, the second I went in there, I knew right away. I was like, at least there's extremely low risk of being hurt. Like, you're having me do some tests, you're working with me, and you're applying like functional critical thought. They're like, oh, if you bend this way, how does it feel that way? Oh, okay. Like,
Yeah.
you got this stuff going on or that, and then that's it. It's like, it makes sense.
Yeah, it's fantastic because maybe to my future detriment, I guess we'll find out, but the place I sit right now is like, yeah, I'm not a fan of medication. I'm strongly inclined to just say no to anything that involves intervention at this point. Like, if someone was like, here's this magic pill, it could be the most magical pill in the world. And I doubt that I would even care about the name of it, because I'm at this point, all I've seen prescriptions do, and I guess outside of, like, you've got a raging infection and you take an antibiotic, like, I make an exception in that category. But otherwise, I look at it as I have challenges, but I can live my life. You know,
Yeah.
I'm still functional. I still have these, I've learned to adapt in the areas that I need to adapt. And I frequently actually have the challenge where when I say to someone, hey, you know, I have these challenges, and the response I get back is, oh, do you? I had no idea. And it's part of it is because I'm lucky to be high functioning, right?
Yeah.
But the challenge is that, you know, expressive dysphagia in particular, you think one word and a different word comes out. And it doesn't happen all the time, but it can happen in really embarrassing and inconvenient situations. And because of, I don't know if it's the same for everybody, but for me, the word makes sense. And I may or may not realize. Like if I realize, I'll correct myself and I'll say, oh, oops, that's not the word I meant. This is what I was trying to say. But sometimes it's a completely different word. And if the person that I'm speaking with is paying attention, they'll go, wait, what? You just said this. Is that what you meant to say? And then I'll be able to go, oh, no, oops, that was my brain doing its thing. This is what I was trying to say. But unless someone sees it happen, it's really easy to minimize. And
Yeah.
it's something that I feel very self-conscious of because I really value clarity of communication.
Yeah.
So it's a big challenge for me, and it's made even harder when someone says, "Oh, I would never know." Like, so you seem like you're perfectly healthy and fine, and like I'm sure that's just the things we say to each other to like try and reassure each other, right? But
Yeah.
I think sometimes there's value in that, you know, wow, I'm sorry you're dealing with that. That sounds difficult. I hope you get it figured out. You know, rather than the, oh, everybody deals with that in some shape or form that, you know,
Yeah.
I'm sure you've heard it too, right?
Absolutely. Yeah, the downplay, like I've gotten that a lot and that used to really, really, really irritate me because my neurologist did it the most. I was like, cognitively, I'm not right. And he gave me this really simplistic neuropsych test, like to test my cognitive functions, and I got like 100% on it. I'm like, this is connect the dot in 10 spots and remember two words. Like, you could, like a kindergartner could do that fine. Like it doesn't mean that I'm okay, And then he's like everybody forgets stuff, and I downplayed it. I just got super offended. I'm like, no, I'm going to see. I'm going to do like a full test. And then, of course, when I did that test, I got like meaningful results, and it showed that my cognitive function was disabled in like several areas and like worse than 1% of the population.
Oh
But
my goodness.
yeah, and you're helping me to understand that. The replacing the words, I didn't know what that was called, and I had that initially. I had it quite a bit, but it has like toned down um, over the last year or two, I think. But I used to just spit out the wrong word, like totally random word instead of what I was actually thinking, and I just kind of took it as like another cognitive kind of defect because I was experiencing a myriad of things at the time. But it's really interesting.
That's fantastic if it's improved though. I mean, it's because it's hard. And I know that sometimes, so in general, I'm not a gigantic fan of labels because
Yeah,
I think labels can serve to disempower us sometimes. But I also think there's a time and a place where a label can help things make sense.
yeah, it makes it
And
clear to people, right?
that's, yeah, and where they can be validating because when you have a problem, you know you're dealing with this problem, you don't have a term for it, you don't have a way to explain it to people, and then you're given a term. An interesting thing, which I found after I was given the diagnosis of expressive dysphagia, I was able to look it up. Want to know what causes it?
Yeah,
Brain injury, strokes, things like that.
yeah.
So
Wow.
what would you like? Is there any surprise that both of us have struggled with that when you
Yeah.
consider what our brains have been through?
exactly. Yeah, it's yeah, just no surprise. That you just nailed it on the head. I remember that too. Like when I started getting some like the cognitive testing and stuff, I could not put a word or communicate like what I was doing, like with my the memory problems I was having. Like there's this functional memory that you jump in, your ability to multitask. There's all these different memory functions that we have. It's not all just recall, right?
Oh,
And
so
when I got the neuropsych, she was like, goes, here's all the different categories of memory. You have mild cognitive impairment, right? She gave me the term. And then I remember now, you jogged my memory, like I went and looked it up, and I actually got a book on mild cognitive impairment that was about reversing dementia because usually when you get MCI, mild cognitive impairment, the next one you get's dementia. So it sparked all kinds of learning for me, right? Because now scientifically it's been categorized, and while you don't want to label yourself as stuck with that condition, it allows us to communicate and learn just a tremendous amount about it, I think.
right. And you just said something super interesting that um, I feel like I'm going to have to go down a rabbit hole on my own now, because I have a very big awareness of the difference in my cognitive processing now compared to before medication. And granted, a few decades have passed. So part of that could just be the natural aging process, but particularly multitasking that you mentioned, that's an area where I realized that I used to be able to be like, doing this and doing this, and I mean, technically multitasking is rapid task switching, right?
Yeah.
And I used to be able to do it no issue. Now I'm slow, and in the neuro ophthalmology testing that I just had done, my discriminatory reaction times are below the normal measurement. And it was just this silly little test of, if you see an alien, press 1. If you see an astronaut, press 2. If you see the planet Earth, press 3. And like that was it. And I was below average uh, from a graphic, recognize what it is and press a number thing. And like it's this but interestingly, when it was stripped down to, if you see this one, press something. If it's not that one, don't press anything. My reaction times were normal for that. So it was only when I had to discriminate of what am I seeing and what do I have to do, that was when the reaction times were below normal. So
Yeah.
I definitely have, like I said, it's encouraging to have things show up in testing. I think the challenge is going to be, one, setting realistic expectations, like what can I gain out of various things and how far do I care to go? Because I don't know what the limits of therapy are after so long has passed post injury.
Yeah. That's an interesting question, interesting thought for sure. You have to wonder. And then, yeah, like you said, it's hard. Like your age is playing a role. There's all these different dimensions of kind of our injury or exposure, if you want to call it that, over the years. Very interesting. Um, I love this tangent. It's absolutely fantastic. Um, but I did want to hear, I know you had an involuntary commitment as well. I wanted to at least hit that um, before we discuss more
Yeah.
stuff or end, and what was that experience like, and where did it come at in that process?
So I had a few in the place where I live, they call it being put on a certificate.
Okay.
And you can be put on like a 24-hour hold, or you can be put on a 30-day hold. And so usually like the emergency room would issue a 24-hour hold. And then once you're admitted, then it takes 2 doctors to sign off to get you put on a 30-day hold. But so I've been on a few of them, but the last one that I was on, I think, is the one that sticks out in my memory. And it's probably because it was one that happened around a time I had more ACT. But it was also the time that I think felt the most underhanded, if you will.
Okay.
Because interestingly, and maybe not interestingly, because I've never been a violent person. I always, if I was told to go into hospital, I went into hospital. So it's not like they ever had to pick me up with the police and force me, because if my doctor said you need to be in hospital, I went. But there were times where, the last time my doctor was going away on vacation,
Yeah.
I guess she just didn't want me deciding to check myself out while she was on vacation. I don't know, because she sent the other doctor, like the doctor who signed off the second one, to speak to me. And I thought I was just meeting the doctor that was covering for her while she was on vacation. I thought it was just a straightforward conversation, no big deal. Like, he's just getting to know me so that it's not someone I've never met when she's away.
Wow.
And so have this conversation where I was perhaps more candid than I otherwise would have been. And then boom, find out I'm on a 30-day hold. And like I was already on a locked ward, so it's not like they really accomplished anything with that 30-day hold.
Yeah. What do you think
And
their motives were, like specifically, or?
I don't even know. Like I was suicidal at the time, which I think was what they used to justify the hold.
Yeah.
But I wasn't threatening to like leave the hospital or anything like that. I'm trying to remember. I might have had no, I think that was right before I was transferred to the unit, where I had gotten upset at something that had happened, and I'd like hidden in a hallway bathroom in the hospital, and they had like had a big search for me all over the hospital, because apparently an adult playing hide and seek is hard to find when they lock themselves in a bathroom.
Sounds so ludicrous to me.
It's funny like in hindsight, but like that was kind of what I did when I felt scared and was, trauma stuff was triggering, was I would look for a small space that I could lock myself in. So it wasn't even like a I'm gonna hurt myself situation. It was really just everything feels out of control and I need a space where I feel safe. And so it was kind of like the literal fight or flight. Instead of fighting, I flighted.
Yeah. It makes perfect
And
sense to me.
yeah, and I didn't even flight out of the hospital. Like
Yeah,
it
like it was
was,
like really benign as well, right? Like,
yeah, like it was like right down the hall of where the unit was. It was, you know, maybe 15, 20 steps away from the unit. Uh,
wow.
and and I took myself back to the unit afterwards too. And so I feel like that had happened right before. So
Okay.
that certificate would have prevented me from being allowed to leave the unit. At that point, they wouldn't have allowed me to go off of the unit since it was a locked unit. Uh, but it's, I still remember being stunned. And I think that one really kind of, it felt unfair. Like I felt
Yeah.
mad about it. And I definitely didn't have the financial resources to be able to fight it. Like you technically have the ability where you could like protest and take it to court and whatever, but like nobody wins. That so far as my understanding is if two doctors have signed off on you being a danger to yourself or others, it's pointless to take it to court because they're just gonna, if anything, extend it longer.
That's generally what I've heard. I mean, in the States, I haven't heard much about Canada, but I've talked to Jim Gottstein before, and he's an attorney in the U.S. that wrote this Prexa papers, and he kind of focuses on that um, form of law. And yeah, they make it's all very like hush hush and like to hurry people through the system, and you have extremely limited rights and no benefit, no kind of, they don't give you the benefit of the doubt at all, and they just always assume the worst and kind of brush everything under the rug. And for me, it's really baffling because all of it seems like a civil rights violation in the first place. Like, this isn't prison. No one's committed a crime, and yet you're taking away their rights and forcing them to stay somewhere. And then on top of that, like it feels like we're violating UN conventions, like with administering ECT and injecting drugs involuntarily, like that could easily be construed as torture, or that if someone was torturing someone, that's what they would do, right? Like it all stops making sense really quick, and I think that's the most disturbing part. And that's why I've been really, every time someone tells me they're involuntary committed, I'm just like, please tell me everything like you feel comfortable telling me about it, because that's something I want to know about. I want to know that if I'm not committing a crime, there's some other way my freedom can be taken away. Like I want to know how that could possibly happen, or under what circumstances it's happening to others. Like that's really a big deal. And the fact that we don't talk about it and it's not commonly talked about is like kind of baffling to me as well, right?
Yeah, it's kind of a, I would say it's very much taboo. Like even the people who are close to me and know about, my history, I generally don't talk about what was it like to find out here's this slip of paper that's been signed that says you're not allowed to go anywhere. And how does that, the one that I told you about in particular sticks out in my mind as a feeling of betrayal. Like I felt lied to by my doctor. I felt outright, like in hindsight, I was able to go like, this was all planned. Why didn't she just tell? Because the previous
Yeah,
times where I had been on a certificate, the doctor had said, I'm going to write the certificate and hold you, and here's
they're
the
up front.
reasons why.
Yeah,
And like, I didn't have any choice about it, but at least the doctor was upfront about it. So I knew what was happening, right?
yeah,
Versus this very underhanded method of, I'm just having my colleague come to meet you because they're covering for me while I'm on vacation, and feeling completely blindsided when you find out that, you know, the whole purpose of this wasn't to have someone that you feel comfortable with on your care team, but instead to put you on a certificate so you could basically be ignored and not cared for 30 days because they don't do shit, pardon my language, but they
yeah.
don't do anything when you're on certificate, and they know that you're going to be on this locked ward for 30 days because they've got 30 days. So like you're kind of a glorified prisoner in a lot of ways, where like here's your meds, here's your private room. If you do anything they don't like, they're going to lock you in your room and take your bed out and leave just a mattress on the floor. Like it's it's this power dynamic where it really
Yeah.
reinforces, be a good patient, do what you're told to do, don't cause trouble. If you do these things, then you earn privileges. But if you speak your mind or you don't do these things, then you end up no better than a prisoner, because they have the ability to lock you in your room. They have the ability to, you know, literally make you ask to go to the bathroom. You're going to have someone who's sitting there looking at you as long as they decide that you need to be constantly watched. And like, there's no autonomy, there's no um, personal responsibility. And it strikes me in this moment again because I was so young when I was going through all of this, and I hadn't figured out how to navigate the world as an adult, how to take responsibility for myself, how to figure out what are the things that are within my power to change, what do I act on, what
Yeah.
do I just let go. And so within that context, you're taking away every bit of autonomy that a person has and making them dependent on the people who are dictating everything. And then you wonder why they can't reintegrate into society and just go live normally and, make
Yeah.
decisions and be independent after they've been basically told that independent thought is wrong.
That's so disturbing, and it's we're talking about this idea of coercion, right? Like in psychiatry, and it's just traumatic. Like I talked to Madeline on involuntary commitment before, And it was the same kind of vibe. Like when I was like, she didn't really mention it, but I was like, when you got out of that, like what the heck were you supposed to do with yourself and your life? Like, like you're polydrugged, like you've just been, imprisoned, like psychologically seriously manipulated for that period. And this is all under the guise of improving your mental health, right? And like giving you a
Yeah.
chance like to recover and to get out on better footing. And yet people I've talked to have had different ideas about IVC. Some were like, it wasn't that bad. Some are like, it's bad. And they give me all the details. But everyone was like, you're come out worse. You're coming out worse. And it's like a deterrent. It's like you didn't have your mental health in control before. Like if you screw up bad enough, like we're gonna jack you up so hard that you're gonna find some way to help yourself, or you're gonna kill yourself. I mean, that was the other thing that we talked about with Madeline was this increased risk of suicide, like through the process and after, right?
Interesting. Yeah, because I know that I was out. So after that, I think I was out for maybe 2 weeks. And then I was back in for maybe 3-ish weeks, like not for very long. And then I was out, and that last hospitalization, which it was so close to the long one that I kind of tend to almost count them as the same hospitalization, because it was like the long one, I went in on Halloween and I was discharged in January sometime. And then
Holy.
I was back in February again. And I was discharged. Actually, I guess I was in longer because I think I was discharged in March. So I must have been in closer to maybe 4 to 6 weeks. And I got home and I'm on this whole whack of medication, and I'm trying to do laundry and I'm feeling horrible, like no better than what I was. And, I'm on the latest and greatest. Like I was put on to, Lamictal, which was not even approved for bipolar yet at the time. So it was just my doctor had read that, this was in testing for bipolar and everything else had failed to work. And so she'd stuck me on it. And I vividly remember being like in our stairwell going from the main floor to the basement with this load of laundry and getting mad and being like, you know, all of the thoughts that you have when you feel suicidal, and being mad because I had promised my doctor that I would never try to kill myself without either calling the distress line or going to emerge. And so I felt immensely trapped that I couldn't live, but I also couldn't succeed at dying. And so in my anger, and it's a distressing story, and yet somewhere inside of me, it's where I found my fight and my will to live, because within that anger of not being able to succeed at killing myself and nothing that I was doing was helping. And, I felt completely hopeless that another hospitalization would change anything, or that there'd be a medication that would change anything. And so in that moment, I made the decision, like, if I can't die, if I have no choice but to live, what do I have to do to learn to live? And out
Wow.
of all of the time that I spent in hospital, nobody ever said to me, what would make you happy? What would give you a life goal? How would you like to live? Nobody ever put those things in front of me and helped me think about those things.
So wild.
It was me finally deciding that I was never going to succeed at suicide. So if I was going to live, how could I possibly improve it? That was what turned the corner for me. And that was when I started looking at the medications that I was on and going, okay, here's these antipsychotics. I know they just make me gain weight and I don't feel any better. Here's these benzos. I'm worried I'm going to get addicted to them. And I started just knocking things out. And I didn't get off everything at the time because that was like 2000 or 2001, but I went down from like this huge list of medication to a much shorter list of medication. And that was the time like I started walking, I got a part-time job, like I was able to actually return to the workforce. And it was just sheer I guess, grit and spite,
I was
you know.
curious. I was going to ask if you were angry. Was it like anger or what? Because there was this point after TMS where I was so angry at what had happened to me. I was just like, F everything and everybody. Like, I'm not going to be mean to anybody. That's not what I meant by that. But it was like, I'm not giving in to anyone ever again. Like, never. And like, I'll do everything I think I have to do to try to like get well and to find whatever justice I can. And that got me through every day. Like, that was it. For me, it was like kind of this anger, you know? I'm curious.
Yeah, I was definitely angry, but I think I was angry in this non-specific way. Like I was angry at life. I
Yeah.
was angry at the world. I was just mad.
Unfairness, maybe.
Yeah, just it was like, here's all this failure and like this isn't fair. And, I guess even now I have a very big sense, like when I see something happening that just feels innately unjust, I struggle with moderating my inner "that's not fair" reaction.
Yeah.
Because it's almost like you can imagine kind of like a toddler who's like, that's not fair.
Good example.
And that's kind of how I feel on the inside about some things. It's like I just get mad because it just feels so unfair. But in this case, it was almost like getting so full of despair that the despair turns into anger, which then motivates change. Like it's kind of it almost doesn't make sense. And it's difficult to explain because
I can kind of feel the
very,
power of the situation and the levity by what you're saying. Just trying to understand it. Just
yeah. And
such a
it's
powerful
like you
moment.
think about how instant it was too. Like this was this big decision and this full of like this, transition from just wanting to die to being pissed off to deciding that my only solution was to find a way to live. Like that happened in the course of like half a flight of stairs. So I guess it tells you how turbulent my thoughts were. That like here's this whole out cycle, and then here's this novel idea that pops into my head of, well, if I'm going to keep failing at this, then I'm going to have to do something different. Let's figure it out. And I started by walking. Like
Wow.
that was my first step. Was I started walking and got off of a bunch of meds that I knew weren't helping me. Um, and from that point forward, that was really also the transition where instead of looking for approval from my doctors, it was more like I had in mind what I needed from them and what I wanted from them. And so I
Yeah.
became okay with going in and being like, okay, I stopped this medication, or I reduced this medication, or this is what I want to do. And so that particular piece, I think, was very empowering because what I needed most in my life was to learn how to be responsible for myself, because I'd spent years being told, oh, it's not your fault. Like what do we tell someone who's suffering from depression? Don't worry, it's not your fault. It's just yada, yada, yada. Take this pill and you'll feel better. But what I really needed to do was I didn't need to be blamed, but I needed to understand that there were actions that I could take that would be meaningful and improve my life, and that I did have power over how I felt and how I lived. And so when you take away someone's power and you say, it's not your fault, just take this pill, you're doing such a disservice because we are so resilient as humans. Like our resiliency and our ability to overcome things is incredible. So, imagine
Yeah.
if you said to someone, like, I'm really sorry that you're in this place. I can't imagine how difficult it must be. What do you think you would need to get a little bit of hope back? Okay, what change can you make today that will start you towards that path? You don't need an answer. You don't need to feel 100% better instantly.
Yeah.
All you need is hope that you've started down that path, and that if you keep putting one foot in front of the other, that you're going to end up where you want to be and you'll feel better.
Oh yeah. I think another big eye opener for me was that I'd fallen into this trap of thinking I didn't need to be responsible for my own decisions and my health, like when I saw a psychiatrist or a doctor, right? And then I was automatically, ideologically, like put into this place where I didn't have to do the things you're talking about, right? Like I didn't have to take responsibility for my own situation. I didn't have to think about what I was going to do to get better, or what I wanted to do, or what I thought I needed to do to get better. Like I just displaced all that responsibility, and that was a massive problem, like for me. Like, and I always thought, or I was indoctrinated to think, that it was okay to relinquish that, and that people would be okay, right? Like you didn't have to be responsible for your own health. You could relinquish that to someone else and it would be okay. But what I've come to realize is that everyone has to be responsible and invested in their own health and their decisions like 100% of the time. Like you're the only one that's going to end up paying the consequence for your health. So there's no excuse for not being 100% all in all the time. And that's coming from even myself. Like if you're incapacitated, like you're still responsible for your health. You're still the one that's going to have to live down the consequence of what people or doctors are doing to you when you're under anesthesia or whatever. Like it doesn't change. Like you can make an excuse for it. They say, oh, well, I was out and the doctor had responsibility. You can say that. That's fine. You're going to have to live it all down. Like,
Right. It's still your body who's suffering as a result of whatever's happened.
and even
And
the justice system is going to be like, I'm not going to hold the doctor accountable, right? Like,
yeah, and it's so hard because, I think back and something I have a lot of awareness around is, some of the beliefs that I have now in hindsight. If someone had said those things to me when I was newly in the psych system, would have pissed me off. I would have cut them out of my life. Like if you were just starting down the path and it came from anyone other than a psychiatrist, nobody's going to be open to that I can imagine, right? Because
yeah,
you're turning to a psychiatrist because you want an answer. And I think, the missed opportunity in psychiatry is that at that first encounter, if a psychiatrist, instead of saying, here, take this pill, it'll make you feel better, if they gave that empathy and reflected hope and held hope for their patient while the patient didn't have their own hope, just hold hope and
yeah,
start them on the path. Even if you're not painting the photo, even if you're like, okay, this sounds difficult, like you're dealing with, let's talk about your sleep. Or let's, how are you moving your body? Or can you get out and walk every few days? Even if it's just 5 minutes, you know, start small, like walk around your block, go back. And when you have those small successes, our brains have an immense reward system within them, right?
oh yeah,
And so you, nobody needs to actually outright say, don't worry about this stuff. You can actually focus on the positive and lead someone down the right path. And I guess right is a strong word, but what I really mean by that word is down a path that's going to support their long-term health,
yeah,
rather than just taking the easy response of saying, here's this pill, take it and come back in a couple weeks and tell me how it went, which really oversimplifies the human experience. And in a lot of ways, even though I know at the beginning, I probably found that reassuring, like, oh, look, there actually is something wrong. I'm being given a pill. Um, you know, at the end of the day, it's not actually supportive because it's disempowering someone at a time when what they really need to do is be told, like, yeah, this is a tough situation. It's going to take some hard work to get out of it, but I'm here to support you and I have some ideas. So here's where we start. Like, imagine how different your story would be if that was the response you'd been given.
I was just thinking about that. I was like, I tend to look at psychiatry as just this defunct, like, hopeless kind of place. But if you change the perspective even like that, I think it would be a vastly different experience for everybody, right? Like, using drugs as a crutch or an option, like, I've never been able to rule that out for people, even for myself. Like, people get into severe places. Um, and to say that no one should ever like take meds ever, like, it's just a strong statement. I don't know if I'm willing to say that, right? But if people were empowered to try other things first, right, and they had the ability to take a med if they wanted to, and or get rid of it as quick as they wanted to, right, I think the game would be so different. I mean, we talked about all these mechanisms of feeling like going to a doctor, you have to do whatever they say, right? And then you have to stay on the medication if they think you should stay on the medication. I think these ideas we have about authority and doing what we're supposed to and being unsure of ourselves really perpetuate a lot of harm. And then on the flip side of that, right, if we had someone that was an advocate that was trying to like strengthen us and empower us, exactly like you said, it'd just be a vastly different picture, right? Like it could be so much better. And then ultimately, I mean, I have faith that people would get out of that system and work towards natural, healthy processes. Um, which is funny because for me, my career really invoked all this harm that I had, and then psychiatry was just an agent, like, of that bad situation from me overstressing myself at work. And so, like, I really blame the way we look at work as a society as a big part of the problem. Like, it pushes people are desperate, they don't want to go to psychiatry, right? No one wants to take a pill for this stuff. People inherently, I think, know that psychiatry is harmful, but we're being desperately pushed to this resource because we have really unhealthy ways we interact with each other. One, I mean, that's a whole nother thing, but and how we look at work. Like, so many people I know ended up in the hands of psychiatry because they were overworked. I just read a paper, I forget, or maybe it was a dissertation that I was reading. I think it was a friend of mine's paper that was talking about how psychiatry is an answer for disability. Like, people are in unhealthy work relationships or patterns, and then they can't just quit their job, right? So they're pushed onto disability, which is validated by psychiatry, and then they're given meds and stuff, and there's this whole process there that's also vastly unhealthy if we look at the reason and the logic behind it, right? Um,
Yeah, it's interesting because I was enjoying the work that I was doing the very first time that I was hospitalized. And, granted, it wasn't like a high paying job or anything like that, but I was working at a franchise that had recently opened. It was retail, and I had basically worked myself up to being backup for the store owners. And so I was doing like ordering and scheduling and stuff like that, which is, in hindsight, quite something to be doing at 19, right?
oh yeah.
Uh, but I enjoyed what I was doing. Like, I liked the responsibility of taking the cash to the bank and filling out the bank deposits and doing the orders. I enjoyed that. And psychiatry actually made me unable to work because I decompensated so fast. And I was on disability for a number of years. And the first time I was on disability, I was so medicated at the time, I couldn't even write my name. I signed the documents with a shaky X after asking the social worker if it actually needed an X or if someone else could sign it for me. And she was like, it has to be you, but it can just be an X. And like the lines of the X, because I saw one of the documents years later, and even the lines of the X were these squiggly lines because I had such bad tremors from the medication. I couldn't draw even a short straight line.
Like medication induced Parkinsonism, right? Like,
Yeah, like it was basically, I guess maybe tardive dyskinesia would be the closest thing to it.
yeah.
And interestingly, because it happened while I was on antipsychotics. So, you know, it was kind of, I guess, expected since they're known to cause that. And then it never went away in all of the years I was on Lamictal. So I believed that I just had permanent tardive dyskinesia, that, you know, some of it had never left. Imagine my surprise when I tapered off of my last medication. And I know that, you know, the listeners can't see this, but look at how steady my hand is now. It's perfectly steady. The tremors are completely gone.
Wow. Did that blow your mind or what?
Completely, because I had accepted it as this is a permanent
This is it.
damage that I have suffered. And I had no idea it was still being fed by a medication that I was on, because I haven't looked recently, but I don't think it was even listed as a side effect for Lamictal that it can cause tremors. But I'd had an MRI to see if I had early onset MS, because I would just randomly, you know, I'd be sitting eating and I would just drop my fork. I couldn't keep the grip, or it would happen with like pens and pencils and things like that. And all of that disappeared once I got off of that medication. Like it, you know, everybody periodically drops things, but I don't experience the same kind of spontaneous where my muscles just let go. And it was shocking the way it used to happen. And that disappeared too. So it's interesting when you look at things that you thought were just how you are because you've been that way for so long, and then you get off of a medication and you're like, oh, this isn't the way I was. This was a side effect that I've been living with for a lot of years and didn't even know it was a side effect.
That's wild. That's really wild. You like your story of healing and after how much you went through, like, is really, really impressive. Like it's really cool to hear that. I really feel inspired. I did before too, when you talked in Inner Compass, right? I think with Sheila.
Yes. Yeah.
Yeah, I really, really enjoyed that. It was the same thing. I was like, some people, you're definitely one. I'm just baffled by like how much they went through and like how well their body bounced back. Because you just never know, I guess. But like, it's very inspiring.
I chalk it up a bit to stubbornness too, because I'm like the, you know, because sometimes when you feel something going wrong, you know, or something just doesn't feel right in your body, you have a choice, right? You can focus on what's going wrong and you can worry about worst case scenarios, or you can believe that it's transient and things will improve and you can hold hope. And I won't claim that I always succeed at holding hope and believing that the best case scenario is going to happen, but it's where I tend to focus. You know, I tend to tell myself, okay, well, yeah, this sucks right now, but it's okay. I'll get through it and it'll be better afterwards. And I think that the brain's neuroplasticity is incredible.
Yeah.
And I'm a big believer that positive intentions and positive belief help with our healing. And, you know, I'm sure there's nothing scientific about that. I'm sure it is all just complete hocus pocus belief. But I do truly believe that when we have hope for healing and when we don't lock ourselves into the story of being irreparably damaged and irreparably broken, I think that's when we have the most room to overcome the things that we've faced and to get the best possible outcomes that we can for ourselves. And that's really how I try to look at it. Like, yeah, maybe I'm not the same as what I would have been without all this stuff, but you know, I've survived things that other people don't survive, and I feel
Yeah.
incredibly lucky, you know, that I'm on the surviving side, that I am able to tell my story and not just tell my story, but be thriving in life and living. You know, everybody has challenges. You know, this happens to be my set of challenges, right? Like, I don't, even someone without psych history, I'm sure by the time you're in your mid 40s, there's a toll that's been taken on the body,
Oh yeah.
and you're living with a set of challenges, whether they're psych challenges or something else, right? And so
Definitely.
I try to keep perspective of this is what I'm living with, but this isn't the end of my life. This doesn't have to be all doom and gloom. I can find a path forward that is full of happiness and hope. And that's where I choose to focus as much as I can.
Yeah, that's absolutely wonderful. Yeah, I know when you say I don't think there's any science behind it, I think I know what you mean, but I do think it's kind of emerging, especially around neuroplasticity, because reading about it, it tends to focus on the fact that stress defeats plasticity, and like it's just your thinking gets rigid, and there's all these bad effects of stress, right? So like the antithesis to that is really positivity, right? Like when we're in a state that's lacking stress and we're positive, I think it encourages plasticity and healing and homeostasis, like you were saying. And I am certain that that's like a massive benefit and a massive secret to what's going on. I mean, I've talked to so many people at this point, and I see that as a theme through people that like are getting better and do well. It's like there's just positivity. They focus on positivity. They grab onto something. And even for myself, I've been through times where I was not doing well, and I spent a lot of time around negativity. I was focusing on negativity, and and then I just seemed to reap that kind of consequence. And then the flip side, like I just take times away from everything, like just focus on myself and just do stuff I wanted to do for a while. And one of my neighbors was actually a neuroscientist, and he ran a research department at a huge um, medical um, clinic in the U.S. And so we had a discussion when I was injured, and where he was talking about all this stuff, right? He's a totally brilliant guy, absolutely out of his mind brilliant, and he's like, don't do any. So this guy, he researches antidepressants for a living, right, for this clinic, and he's like, don't do SSRIs or any psychiatric drugs for more than 3 months. Like, don't do it. He's like, don't take benzodiazepines. Like, it's going to make your injury worse, or you're not, it's not going to go well for you clinically. Like, from what I've seen, it's a bad idea. He's like, you need to get everyone out of your life that's not positive. Like, he's like, get rid of them. He's like, I don't care what you have to do. I don't care if it seems mean. Like, get rid of them. He said, and just focus on you doing what you want to do and being positive for as long as you can. He said, you're going to survive. Your brain will heal. Everything will get better. But that's what you have to do. And I was expecting this really sterile, like clinical advice from him, and that was the summation of his clinical experience. And he was communicating that to me face to face as like neighbors, invested in each other, like helping each other out. That was a really, really powerful moment to me. You reminded me of it. It happened quite a while ago, but that definitely changed me, you know.
That's amazing. And it's, I something that I've kind of used in my own imagery when I'm having moments that are tough or something comes up. And, because life isn't always perfect, right? We're going to have stress or we're going to have things that upset us. And the way that I make sense of it now is to tell myself that it takes every emotion to fill out a rainbow of emotions. And like the rainbow, right? Like, say you don't like the color indigo. Well, you wouldn't have much for rainbow if you took out the color indigo or you took out the color yellow, or,
Yeah.
sometimes it's not about whether we like what's going on or not, but just being whole, having all of those pieces. And so, what I don't always succeed at, but what I try to practice is in the moments when I'm feeling, less positive, is to practice gratefulness that I have the ability to feel that way. Because even if it doesn't feel great, I know that it will pass. I know that it's temporary. And I would pick being able to feel all of my feelings, including the difficult ones, every day of the week over being numb and out of touch with myself. And so I even when, there's something that's been upsetting or I'm crying or, whatever's going on, I still feel grateful for having that full range of feelings because I haven't always had that full range of feelings. And I think that, someone, couldn't tell you who, someone talks about attitude of gratitude.
Yeah.
And it's like kind of catchy and rhymes, right? But if you can feel gratitude for the challenges in life, it creates opportunity rather than pitfalls. And if we make use of even some of our opportunities, we're going to be further ahead than if we choose the pitfall option.
Oh yeah. Absolutely. That's such an excellent perspective. As you were saying, I was thinking the same thing. After coming off TMS, like I couldn't experience any emotion except for the negative sensations in my body. And once I started feeling them again, I was so grateful because I had basically begged for them for like 2 years. Like I wish I could just feel something because I can't feel any like emotion, any positivity. Um, and that's really excellent perspective to have. Like it's just so helpful. I mean, that's my takeaway from this conversation is like to focus on that. I forget about it often, but really, like it is so powerful. The times I've been doing that a lot and focusing on that, I've done a lot better, and it was really really helpful.
It kind of has a magical effect of reducing the feelings of discomfort and distress as well, because if you start thinking about thankfulness and just being glad that you can feel, well, those are more positive feelings, right? So
Oh yeah,
it can be it can be, in my experience anyways, it can be quite helpful to shift perspective. And sometimes for me, all I need is to shift perspective because it's all about, you know, not falling down a hole where you lose perspective, right?
yeah, yeah. Doing the opposite of that, right? Like whenever I get into trouble, it's because somehow I've managed to focus on the negative and like get into this pit of a poor perspective, which is funny because whenever if someone can just get me to step back for a minute, I'm like that's not true, like why am I so fixated on like deteriorating or something bad's going to happen to me or things constantly bad happen to me, like it's just not it's not realistic either.
Yeah, I think that's, you know, because both you and I have dealt with like the traumatic head injury side of treatment. I think that fear at times, for me, it definitely steps in and I'm like, okay, yeah, like what if this little thing is just the beginning of a big thing? And I kind of have to,
Yeah.
reel myself in and bring myself back and be like, okay, this is just a little thing right now. And I'm going to enjoy today. And if it turns out it's a big thing, at least I'll have enjoyed every day leading up to whatever comes, because you can't change what happens in the future. Like none of us control the future, right? So you can lose the present by fearing the future, or you can live every moment to its fullest. And then come what may, you deal with it when it happens.
Yeah, I like that. It's like I tell myself often now, I'm like, how do you want to go out? Like, you don't know if you're going to survive to tomorrow, right? I'm like,
Yeah.
you might as well go out in the way that you want. And I think that's really powerful and helpful too. Um, we captured a lot of your story. Is there anything else? Is there anything you think we missed that you still want to talk about?
Hmm. That's a big question. I don't have an instant answer, so I don't think there is right now. I feel like there was something, but I don't remember what it was. Um, I guess the one that last thought that I would have is for how much harm comes from the system, for how much, the psych system, for how much it fundamentally disempowers people, that if there is a necessity to engage in it, there are ways to engage in a way that doesn't give your power away.
Yeah.
and I mention it only because I currently have a psychiatrist that I see still, even though I'm off of meds. I see him for therapy, and it's very much on my terms. It's very much I'm empowered
Yeah.
in that relationship, but it's been a very healing um, relationship because it's allowed me to process the trauma of being in the psych system. And I think it probably takes a really special psychiatrist to deal with trauma that's been caused by the system that they work in.
Oh yeah.
But I've found it very supportive because I can be brutally honest about the things that go on behind closed doors that feel almost too bad to talk about, right? Like there's things that happen on psych wards that if you told someone who'd never been on a psych ward, sounds, like a human rights violation. And it's interesting your comment on that because a different professional that I work with, I recently had told a story about something that had happened on a psych ward, and he described it as being a human rights violation, that I was imprisoned against my will.
Yeah.
And having that reflected back to me, it's it's impossible to actually give words to what that impact is, because it's like having that scene for what it was and not just prettied up or blamed on you,
Yeah.
because so much of what happens in psychiatry is if it's going well, the doctor gets credit for it.
Yep.
If it's going bad,
It's your
you as
fault.
the patient get blamed for it,
Yep.
right? Like, how messed up is that? If the doctors gets the credit when it's going well, then shouldn't the doctor get blamed when it's going bad?
Absolutely.
Or um so at any rate, I guess that's, finding someone who's safe and can validate your experiences, and offer compassion, because just going through the psych system, even if it was all beautiful, I don't think I can't imagine anyone having a picture perfect experience through the psych system because it's so disempowering by nature.
Yeah.
But I think it's so important to process what we've been through, and to really give ourselves the opportunity to both feel the pain of what we've been through and heal from it, so that we can move on. So I think, whether it's someone in this, it's probably not feasible for most people to find someone in the psych system that they can trust, but there's got to be enough therapists out there that are safe, or, maybe it's a friend
Yeah, I
or
was
a
gonna say
support
there's
group or
therapists and
whatever.
we have each other too, right? Yeah.
Yeah, like I guess just don't minimize the impact that having been through the psych system has on you, would be my advice. And be gentle with yourself and search for ways to take back your power. Get in the habit of practicing, why do I think this is a good idea? Who am I trying to please?
Yeah.
Am I doing this for me, or am I doing this for someone else? And that's not to say that there's not things that we shouldn't do for people, but
Yeah.
I think when it comes to our inner landscape and our overall well-being, those are things that we need to do for ourselves. Like, other people around us benefit from it, but as I tell my kids, there's only one person you spend your entire life with, and it's you, right?
That's a good one.
So
I love
so
that.
take care of you, and that includes your inner world, and calling a spade, and
Yeah.
than doing the work to heal from it, because it's so empowering when you start doing that work and you start kind of feeling like you're maybe not completely on the other side, but you're far enough across that bridge of processing that it's no longer completely traumatic to think about the experiences you've had, and you can see the pieces that are broken, and you can validate yourself and your own experiences. And we all deserve that validation and support. And so I guess that's my last comment, is really just get the support you need and find a professional who will validate you and support you in the way that you want, not in a way that takes away your power, but in a way that keeps you fully empowered, and run fast from anybody who wants to take away your power.
Yeah. I couldn't echo that more. That's what I've been doing and learning. Um, and I tell people often, like, don't be afraid. Like, fire your doctor. Like, find one that is going to work with you, because I couldn't agree with you more. I think it's proportionately powerful, right? As harmed as we get and how disempowering it can be, it's inversely powerful to find someone you can work with that's on your team, that you work through the stuff with, and you get help from. Like, the doc, I have a doc now that, like, he just gets my thoughts on stuff. We team up on stuff. We're both trying as hard as we can to figure it out and do what we can, and that's, like, it's synergistic. Like, it's incredibly powerful. Like, just what you're saying just resonates with me so well. Like, I completely agree. Like, it's a game changer. And I think people, like, at first I was discouraged. I thought that's not possible, but it absolutely is. You know.
Yeah, and that's exactly why I mention it, because I jokingly say I have trust issues, except for it's not a joke, it's the truth. Um, but what I've been learning recently is that when you have supportive people in your life, you can learn to trust again, and that with that trust comes new opportunities for healing. And we can't go through life as islands, completely
Yeah.
unable to trust anybody else. So finding that space to feel safe, to start trusting again, is a super important piece of recovering from having been part of the psych system.
Oh yeah, I completely agree. Okay. Thank you so much, Trudy. It was so good talking to you.
Yeah, thank you.
All right, have a good night.
Yeah, you too.